everyone. Welcome back to UCLA Health's Medically Speaking. I'm Dr. Eve Glazier. Rarely does someone enter a healthcare system feeling their best. Whether it's a clinic visit, an urgent care stop, or a hospital stay, people are often scared, uncomfortable, exhausted, or even worried about someone they love. Families are trying to listen, remember details, ask the right questions, and advocate, all while managing their own fear and uncertainty. And yet, in the midst of all of this, we ask people to trust us, to understand complex information, to make decisions that feel overwhelming or life-altering. So when we talk about patient experience in healthcare, we're not just talking about run-of-the-mill, straightforward customer service. We're talking about what it feels like to be vulnerable and how that vulnerability is met in exam rooms, clinics, and hospital hallways by healthcare clinicians and staff. And creating that thoughtful, compassionate experience in moments, if not minutes, hours, days, this is not easy. It's incredibly humbling work. It requires empathy, systems thinking, and a deep respect for the human beings on both sides of care. Joining me today is UCLA Health's Chief Patient Experience Officer, Julia Gaviria. Julia oversees everything from language services and volunteers to service recovery and culture, work that touches patients, families, and staff across all our clinics and hospitals, and often at the most intense moment of their lives. Julia, this is not a role for the faint of heart. I really, truly already tip my hat to you. Thanks for being here and welcome.
Thank you so much for having me. I'm thrilled to be here.
I have so many questions. Before we get into the specifics of your role, let's start broadly. So when someone asks you what you do, let's say you're at a dinner party, how do you explain what a Chief Patient Experience Officer actually is?
Oh, sure. I don't go to many dinner parties, but
because you're busy experiencing.
So when someone asks me that question, the answer that I would give, or what I think about, is really thinking about any kind of consumer experience. We all are consumers of some degree and have experiences, but when we enter the healthcare landscape, we become this incredibly vulnerable human or family member. And my job, my team's job, is really to understand, assess, measure, and respond to that experience that the patient has across the entire care journey for their care.
And when does patient experience matter most? I mean, in your experience and for your team, sort of when care is going, I guess, smoothly, or when things are in these more vulnerable moments?
Oh, great question. It's everywhere. It's in every moment. You know, if you think about patient experience or any kind of experience, I think oftentimes we think about the catastrophic events that happen. We, of course, will respond to those. That's a really big deal. It requires a lot of teams and system thinking. But patient experience happens way before the patient even enters the hospital or way before the patient even arrives at the clinic. It's when they're deciding that they want to go to UCLA, when they want to get an appointment or have an appointment, or thinking about the fact that they need to think about their healthcare. Just the entrance point of someone going online and experiencing what it feels like to get an appointment. That is an experience in and of itself. And so the experience starts when we think about getting care, all the way through every milestone that happens in between that, and then all the way until they get billed 3 months, 2 months later. That's an experience. I mean, did we educate them properly on their billing? Did they know that they were going to get a bill? All of that is part of the patient experience. And so I think every single moment is a reaction to the patient experience journey. And
informs each other. I think about this all the time because, when I'm in clinic as a primary care doc, the experience that my patients have when they're getting roomed, when they're getting their blood pressure, taken, their interaction with our front desk staff, all of those things then inform. It doesn't what happened. I'm only kind of in these four walls in a exam clinic, right? But it's all part of that experience. Even those things that aren't even in our control. I think about this when my patients go to a pharmacy. They might not go to a pharmacy that's owned by UCLA Health where I work, right?
Totally.
But their experience in obtaining that medication still becomes part of that overall healthcare journey. And I feel like we're all responsible for it. Like when people are like, healthcare is broken and they're yelling at me, I'm like, I feel like I broke it.
It's really hard. I think physicians especially, or maybe we should say care providers, have a really hard job. There's statistics that show that anybody, so a consumer, we'll take a patient out of this for a second, but a consumer, when they experience 1 to 2 errors relating to their experience, they're 62% less likely to go back, or they're 62% less satisfied. So all of a sudden, the patient gets to the front desk person is mad at them. Maybe the parking was expensive. They didn't realize they were going to have to pay for parking for this appointment. Then they get to the provider, and now already the provider has a really hard job climbing uphill. And so it's really challenging. However, the provider can also win them back. We can win them back. The front desk person can win them back when we look them in the eye, when we make them feel seen, when we say, thank you so much for coming to our clinic. Ugh, I know the traffic was so hard today.
And just validating.
It's just validating. It's validating in their experience.
Yes.
And again, people are vulnerable. Nobody wants to go to the doctor. Nobody wants to navigate an illness or an injury. But when they are doing that, we have a responsibility as all healthcare workers to ensure that we're at least acknowledging that they've chosen us to take care of them.
But I also like that this is a team approach to it.
Totally.
I mean, it acknowledges that, look, I might be seeing you in the clinic and examining your belly, or we're talking about something, but all of it, it's this entire approach. And I just want to clarify something too, because when we say the two errors, we're not necessarily saying a medical error, right? No, but like just like any sort of misstep, right?
Yeah.
Mishap, or just something that doesn't feel great. But what you're also saying is, because I commit, quote, errors all the time, is that they can be recovered even in these small moments. But these small moments matter.
They do, and they add up. And so we have to think about, okay, how do we recover these moments, and what might that recovery look like? And everybody's recovery might look really different. So to your point, the person working at the front desk, just acknowledging, looking in the eye of somebody is recovery.
Yes.
If someone has had a stressful morning or the parking was difficult.
Yes, which I'm sure it was.
Let's acknowledge it, and let's own what we can in the moment. Let's have the accountability, and then all of a sudden the patient builds trust between us and them, and the encounters continuously go well.
That's an incredible link, though, that the looking in the eye, or just the acknowledgement,
Absolutely.
the validation, that's that bridge to trust.
Yes.
When patient experience breaks down, like what is it usually about? Like what are you sort of usually seeing? Are there patterns?
Totally. Major patterns. I think 9.9 times out of 10, it's always about communication. We have dropped the ball in communication to some degree. And it might not be that we didn't tell them about their illness, or we didn't tell them what the next step might be from our vantage point, but communication between handoffs. Healthcare is so complicated, and now we've gotten to this point where you're not even seeing a specialist, you're seeing a subspecialist. And then your subspecialist knows another subspecialist, and there's communication between them. Patients are navigating things that are very novel, I think, to them, but they might be everyday occurrences for a given provider, because that's our place. That's what we know. But I think we have to figure out, how do we communicate not only what we know, but what the patient needs to know to feel informed enough and educated enough so that they feel safe, so that they do feel like they can trust us. In these moments of breakdown, or in these continuous, whether they're grievances or the complaints that we get, again, it's constantly about the communication. We didn't explain it well enough, or we didn't explain it in a way that made the patient feel like they were safe, like they could trust us. And it might have not been the provider. It might have been the person from one clinic to another, or one hospital to another, or one provider to another. And so it's about that handoff. And I think we really need to think about what does that look like for the patient?
It's very challenging, because, communication alone is challenging enough and so important, and the language that we use and how we say it. And then you add these contexts then you add on like all of the medical jargon, right? And then on top of it, these layers of often uncertainty, right? Yes. Or patients are, as I said, patients are coming, they might be in pain, right? Or they're afraid. So, it's just this level and acuity of communication that I feel like is unmatched.
Oh my gosh. I'll give you an example. Recently, a patient sent in a complaint saying that he was incredibly upset that we are charging him every time a nurse came into his room. And we thought, what does that mean? Like, how did that occur? So he said, well, every time somebody came into her room, they scanned my band, and that I imagine that you're billing me.
Oh, wow.
And so in the hospital, everybody is wearing an ID band, and we scan it to make sure that we are appropriately scanning the right patient, administering the right correct meds to this patient, et cetera. Patients transfer beds all the time and move around, so we need to make sure that we have the right patient in front of us. And the nurses were doing their job. We have to do that. That's a safety mechanism. The patient thought it was a billing mechanism. Nowhere did we explain, hey, I'm going to scan your band now. When I scan it, I'm just making sure that you are Bob Smith.
Yes.
Or whoever it was. It wasn't Bob Smith, but you are this person. And so I think
And can you imagine just like every time that the nurse did that, though, just like the fear,
Totally.
if not resentment, and then additive and accretive?
Oh my gosh. So, and you can imagine that, patients are vulnerable. They're scared. They're sitting in their hospital bed. They have no idea what's going on oftentimes. They don't know when the next procedure is. And neither do we sometimes. But I think when we communicate or overtly communicate and say, hi, Bob, again, I'm just scanning your band. Here's why I'm scanning it. I'm just making sure you're the right Bob today.
Right.
That
not
is
making any assumptions.
It is so critical.
It really reminds me too. I mean, my dad was a doctor, and so I just actually feel very comfortable in hospitals. But most people do not feel comfortable walking into, any sort of medical space.
Yeah.
And so I think always have to remember that.
It's such a novel space for people. I mean, people walk into the hospital and instantly, I think, even parking.
Yes.
People come to park before they get into the hospital, and there is a sense of fear. There's a sense of unknown. They don't know what's going to happen.
Oh my gosh, just trying to find your way into the building.
It's really challenging. I mean, that's part of the experience.
Yes, that's part of experience. It's interesting. Yeah. So, I mean, there's like were you, I really want to know how you got into this, right? Because there's the patient experience, right? And the customer experience, right? And going back to my business school days of like the customer journey. Yeah. I mean, were you always thinking about experience in terms of patients? Is that your background?
My background is in hospitality. My background is in healthcare, and then before healthcare, hospitality. I started a career in hospitality and then entered into fine dining and focused really on service and what it really meant to create an experience for somebody in the restaurant. And I was working at a restaurant that was a top 100 restaurant in the world. I mean, every single detail mattered, from the moment we called the patient or they called us to make a reservation to the moment.
I just love it. You said the patient. I love it. I love it. Were you at the Bear?
The guest. Yes, I worked at the Bear. And so every detail mattered. Yeah. Every detail, and how you made somebody feel and what they were experiencing. I mean, those few hours that they were there, they were supposed to experience this amazing, life-changing moment of this meal. And what I really kind of gleaned from that was you can create and craft experiences because by way of really understanding how somebody is feeling and engaging with them and understanding what they might want or dislike. And, in fine dining, it's incredibly specific. You're thinking about your voice and where your hands are and how you're serving, and it's so detailed. But it's really also it's a human experience because you're relating to humans all the time.
Yes.
So I worked in fine dining for quite some time, a handful of years, and then actually one night somebody had a stroke in the middle of the dining room, and I was the service director at the time, and the person who had a stroke got, of course, taken away by the ambulance, and it was a whole scene. And this is, you're working in fine dining, so it's very quiet and very proper, and it was quite a, quote, disruption. And the chef had directed me saying, we need to apologize to every guest, and let's do champagne for everybody. So I was going around apologizing for this disruption that had just happened. And in my head, I'm thinking, disruption? Like, this person just had a stroke. I need to make sure that they're okay. And I think at that moment, I thought, I'm in the wrong industry. I really wish that I was the paramedic that took this person away, let alone, serving champagne to these people, apologizing. And so I really got such a wonderful experience learning about how to craft experience in hospitality. But what I knew, and since being a child, I mean, I was pre-med and my whole thought was that I was going to be a physician. I thought, you know what, I need to go back to healthcare. And so I went back and sort of started my career in healthcare at the very bottom, but nonetheless.
In a career where all the customers are disrupted.
Yes, everything is disrupted. Yeah.
I love it because you obviously just want to be in it.
I do. Yeah, I love it. I think healthcare is it's such a unique experience because nowhere else in any industry that I can think of, you are this vulnerable. And the person entering healthcare is that nervous or that fearful. And
it's a very specific customer.
It's a very specific. I mean, I can't compare it to anything. Somebody compared it the other day to, unless you are in jail calling a lawyer. That's the only maybe suitable comparison that you can make to a patient.
In terms of like stakes.
In terms of stakes,
yes.
Yeah. And how nerve-wracking it might be for somebody. So I really love the idea of thinking about, well, how do we make an experience feel good and right, not just for the patient, but for the entire system. It has to feel good for the employees,
as they're moving through these systems.
Absolutely.
Yeah. I mean, you talk about the healthcare journey. I sometimes use this word care continuum. And what I'm trying to say is that, care continuum means like sort of time from like, sure, birth to palliative care, but it also means like physically the care continuum, as you're saying, from like the moment I'm researching, coming to, a healthcare system to being seen in clinic, getting medications, getting equipment, medical equipment, and that journey through, different conditions and chronic diseases, whatever they are,
Yes.
but, having a baby. So there's just all these different spaces. And so I also, though, again, that just to me, fine dining seems very challenging. But again, there's so many different spaces that you're kind of overseeing. This is like it's life, right?
Absolutely.
You're overseeing like life but really touched by, again, these very, very high stakes.
Yeah, every moment, to your point, like the continuum is ongoing, but every moment you have these sort of time-bound encounters that
Yes.
I think it's really important for people to understand that in each moment there is an experience that you're having, and then that experience is so multifaceted within that time-bound encounter. So it's just so layered.
And like you're saying too, it's physically how you're feeling, emotionally, but then it's economic, right? Because billing is a big part of this too, and then it's just logistics, right? I need to go and get meds.
Yep.
I would love to kind of talk about some of the areas that you oversee through the Office of Patient Experience. I think that many people probably don't immediately associate, with quote experience.
Yeah.
But language services is one of them.
Yes.
Tell us about what that includes.
Language services is so amazing. So we have within the department, we have a team of language service team members, and they are in-person interpreters. And what we offer is an in-person interpretation. Right now, we offer Spanish. So we have such a diverse patient population, many of whom don't speak English. And one of the things that is really important for us when a patient enters our system is asking them, what is your preferred language? What is the language spoken in your home? And then they can share that with us. And if they decide that they need an interpreter, we can offer that to them either in person or through video or telephone, depending on what the needs are and depending on what the needs are of the team, et cetera. It's such an amazing thing to witness somebody who doesn't speak English having an encounter with a provider who maybe doesn't speak that language, that native language of the patient, and then having this third person there as that sort of triangular support. It is a magical experience to witness.
I can tell you as a provider, it's quite magical and essential, to have an interpreter with you during an encounter, because nothing is worse than feeling like, oh my gosh, I'm butchering a language, and then also I'm not getting the accurate information, but also too, and then or like whatever, I might be using Google Translate. It's very hard for me to make eye contact, right?
Exactly.
To your point earlier, with my patient, and also like it's very hard to build trust without just that basic communication. It's interesting to me how you said, and again, this is language, which isn't essential, but like, what's your preference? And it just makes me think of your fine dining experience when you're like paying attention to people's preferences. But again, that preference ends up being, I'm guessing, right, like their truth. I mean, it's very important.
It's interesting. I think there's an equity piece in this too around language and ensuring that we are being as equitable as possible. Saying to somebody, I think I'm actually saying it wrong. When we say to somebody, what's your preference? Somebody might say, given the times that we live in, somebody might say, oh, it's English. But if we say, what's the language spoken at home? Then we're actually digging in a little bit further, and somebody might say Spanish. Now, that allows us to say, okay, how comfortable are you hearing your healthcare or learning about your healthcare in English? And then it sort of brings the narrative a little bit closer to the truth of what we need to provide for that patient.
Absolutely.
So it's really, again, it's very nuanced. How we encounter and how we interact with these patients is so critical from the very jump of even them just filling out the forms, because those are the types of questions that then engage us in different ways.
Yeah, which is already overwhelming. Medical and what we call medical literacy, like it's hard enough in your own language, let alone in another language.
Yes.
And as you said, we're in Los Angeles together, and we care for patients from all over the world. But you mentioned Spanish, but what does it take to support the kind of the level of diversity that we have?
Great question. So within the language services, we have these interpreters who are speaking Spanish in person at UCLA, but we also offer any other language needed across the spectrum of languages through video interpretation or telephone. So say somebody walks in through our ED, they speak Russian.
ED's emergency department.
Sorry,
everyone.
emergency
That's
department.
Okay. It's my job.
Insert a language. We can offer interpretation pretty much on the spot through video interpretation or phone call. And that is critical, again, to your point, so that we are offering the same quality care to every single patient.
Yeah, it reminds me that health equity, right, is quality of care.
Yes.
How well you take care of someone has a lot to.
Absolutely.
You also oversee volunteer services. You do a lot. Tell us why volunteers matter so much.
Oh my gosh, the volunteers, they have such a special place in my heart. So at UCLA, we have over 1,000 volunteers. And these are folks who are retired. Maybe they've worked at UCLA for many, many decades. They all have different interests, and they all do different things across the whole system. We have folks who come and volunteer, and their job is to hold babies. They're baby holders, and they come in and just hold the babies that need a little bit of extra touch and love when their parents can't be there. We have volunteers who come in with their animals and do our People Animal Connection volunteer program, where we allow for animals to come in and visit with patients and employees and just bring joy to the floor. It's such an important part.
They bring me joy.
Yeah, they bring everybody joy. I mean, who doesn't want to pet a dog when you're sitting in the hospital? And we have volunteers who work at our front desk and answer phones and offer snacks to employees. I mean, our volunteers are such an essential part of our system.
They run the kindness carts.
They run the kindness carts. I mean, they do so much, and I think really are part of the heartbeat of, I think, our system in a way that doesn't always get acknowledged.
And then there's also programs like the 3 Wishes program, which is just this incredible, program at the intersection of experience, dignity, end-of-life care. Tell us why that work is so important. I didn't know that was under you as well.
Yes. So Dr. Neville does an amazing job running this program. She started it at UCLA. So this is a program that focuses on patients who are at the end of their life and where death is really imminent. And we offer them various wishes that they might want to kind of navigate through or experience, honestly. And it can be as little as recording the patient's heartbeat and putting it in a teddy bear for the family. It can be as big as a luau. We had a patient the other day who he has a home in Hawaii, and he really wanted to experience his home in Hawaii, and we obviously couldn't get him there. And so we created this luau for him. And Dr. Neville and her team do such a sensational job really bringing joy and life to a patient who's at the end of their life, and the family is involved, and it's really what they want to see happen really comes to fruition. And it's really unique to UCLA. I think it's providing not only dignity, but I think peace of mind and honestly joy in such a sorrowful time. I can't think of something that is more unique and special.
It's so meaningful and so special. I was looking on the 3 Wishes Instagram page.
It's so nice.
Oh, well, yeah, no, it's just so amazing. And Kay, who's part of our team, helped make the luau happen, which was amazing. But one of the patients really missed their Irish whiskey, so that they put the Irish whiskey in the the IV push for the last push. But to me, the common thread of a lot of what you've been saying, though, is just really acknowledging. Sure, it's the humanity, but it's the individual wishes. Totally. And again, I'm just going back to, it's not just the preferences just can sometimes just sort of feel like, right, I'm at a hotel, my preferences. But no, it's really like the acknowledgement and seeing people for who they are. Yeah.
Absolutely. I mean, we're not putting chocolates on people's pillows. We are really thinking about what is a one-size-fits-one experience for each patient. And it is different. Every patient is different because every patient is a human. And so humans are different. And I think we have to remember that. That's why we need to get to know them. We need to build trust. We need to look them in the eye. We need to get to know their families. It's so important.
I couldn't agree more. That sounds very, very hard at scale. So tell me how do you even just kind of start even thinking about doing it?
I think when I think about patient experience, it's 2 things. Patient experience to me it's a signal and it's an outcome. So the signal is what's going on? What are the things happening? What are we hearing? What are we hearing from our patients? What are we hearing from our employees? That's a huge one.
Yes. What
are we hearing from the families? The outcome is the metrics that are tied to patient experience, and they're very intricate and sort of detailed if you look at what that is really measuring.
Right. So you can we have metrics. You can measure experience.
Absolutely. Yeah.
And then if you measure, then you can improve it or build on it.
Exactly.
Yes.
And so when I think about the measurement of it, we can dive into that, but what that is and then what's being signaled before it gets measured, that kind of helps me and the team organize around, okay, what are the initiatives? What do we really need to think about and change, and where are we doing well, and where are we seeing some improvement?
So what are some of the signals?
So I think the biggest one that I think is most important to listen to is employees. What are employees saying? When employees are flagging that something is difficult, we have to listen to that. If it's difficult for them, it is a poor patient experience. For example, something so simple as when a computer is broken, when a nurse's computer is broken inside the room, they might say, oh yeah, that's been broken for a couple weeks or a couple months. I just use the one next door. Well, if they're using the one next door, maybe somebody is already using that one and now they are delayed. And now what's being delayed? Medication that's being sent up, or a consult that needs to visit the patient, somebody coming in addition, or an extra person on the team. And so we have to think about what are our frontline workers telling us. And if they're telling us something, let's listen, because that guaranteed is affecting the patient experience, satisfaction, and just overall sentiment.
All right, that's so interesting. I mean, it makes total sense. It just wasn't the first thing that came to mind. But right, and especially too because patients listen to us too. So I even remember, when we first started, doing a lot of work on the computers, it was very helpful to be reminded, don't be complaining about the computer while you're talking to the patient, because then the patient's like, why is this person so irritated?
Totally.
Patients pick up on that too, and bringing it in. So all of this has that trickle effect too.
Absolutely. I mean, other signals throughout the hospital, or even throughout our clinics, within our system, employees share a lot of really good information of what's going on, what's difficult, what's not working.
And they care about their patients.
I think one of the things that's one of the biggest goals for patient experience is, I think, reducing friction for the system and reducing suffering for the patient. So it's an individual focus, and then there's a systematic focus, and figuring out how those two work together can, I think, be at odds, but I think most times they really go in tandem.
No, you're beautifully describing how these things connect. That's amazing. I mean, I think going to then kind of, so we're talking about signals, but talking about then outcomes, I think that people do associate, customer service. I mean, probably thinking about fine dining and hospitality, about scores and reviews. What do we do in healthcare? I mean, what are we measuring or trying to measure?
So when we think about measurement of satisfaction, in the early 2010s, maybe 2008, CMS, Center for Medicare Services, came out and said, we're going to start measuring satisfaction. Now, before satisfaction was being measured, what was being looked at as a measurement for the hospital or for the healthcare system were clinical outcomes. Did we do a good job on the surgery? Did the patient
someone
survive?
Die? Right.
Yeah, exactly. Did somebody die? Now it was, did somebody die, and how did they feel about their experience? And that feeling got tied to this metric called HCAHPS. And that stands for Healthcare Consumer Assessment of Providers and Systems. And so this was an assessment of how did we do? And that assessment is then broken down further on how is the communication with the nurses? How is the communication with the doctors? Was it clean? Was it noisy? What would you overall rate this system?
Yes.
Would you come back? What's your likelihood of coming back? And so if you dig into those individual metrics, those sub-metrics under HCAHPS, that's really where we can kind of dig in and think, ooh, we have some work to do on some communication. We can think about, well, how are we communicating? Are we looking at people in the eye? And are we sitting down when we're talking to them? Are we making them feel heard? So that is the scoring system that really allows hospitals to engage with the satisfaction in a way that is really measurable.
Right, and actionable.
Absolutely.
That's extraordinary too, because it just happiness is just, to me, a very kind of empty word. It's just, and also sort of even before you even have this scoring system, were you happy is nothing compared to, by the way, the challenge of, did you trust everyone? Right. But trust, it reminds me too that trust is, when you have it, right, is much more sticky, right? Totally. And it's going to survive and withstand, a lot of the trials and tribulations that come along any healthcare journey. But the things that you're then scoring make total sense to me, right? Because those are things that we can measure. Obviously, I think, I don't know, you tell me, but it seems like even from a customer, from a patient, if someone's even just querying or surveying me, again, I know we're not trying to over-survey people, but even just someone asking me is a gesture to me of, we care about you.
Totally. We do care. I mean, we want to know, how was the communication? Is it clean? What do you feel about this system? And rate us on all these things. Right. And we listen to that, and we look at that, and we dig into it, and then we find areas of opportunity that we can really dive in deeply and improve upon those. I mean,
do you ever get any pushback kind of about measuring, or kind of the things that you're emphasizing?
From the patient or from the system?
Both, or even families.
Oh, yeah. I mean, I think people have an expectation, especially in today's world. We all are consumers. We all have an expectation that we want things to go well. If we're going to choose to be in a specific space or choose to consume a specific product, we want that product to work. We want that experience to go well. Healthcare is no different. The difference is healthcare is a lot stickier and a lot more friction forward. And there are so many moments in the journey or in the experience that are just challenging because it's so convoluted and messy. And so figuring out how to navigate that is challenging and can be challenging. Where we get pushback, I think, is that standard expectation of, well, of course, why isn't this going well? Why is this so noisy? She didn't explain it to me well. And so I think thinking about digging in further and understanding what a patient really means when they do push back or when we are questioning them on
where they're coming from.
Where they're coming from. Yeah, understanding like, okay, wait, let's take a step back and think about where's the patient coming from? What are they navigating? What are they dealing with? No wonder they're frustrated. And then also working with the provider, there's a lot of entities in the system that create friction for a provider, for a nurse, or for any kind of clinical partner or other that doesn't allow for this easy, seamless engagement with a patient. And so trying to figure out what those are, eliminating as many of those as possible when possible, that's when the machine really starts to work together.
So this, I think this transitions great into, service excellence and service recovery.
Yes.
I think those are, for people who aren't in maybe a hospitality or even our industry, maybe you could actually even just define those a little bit, but how do you define that in healthcare specifically?
Absolutely. So I think patient experience is obviously the continuum of the journey, what is the sentiment, what is the satisfaction? Service excellence is sort of that cherry on top, if you will, of what is our culture? Like, what is maybe not the cherry on top, but service excellence is really the culture identifier for who we are. How are we doing? And when we do it, what does that look like? So I think OPX, Office of Patient Experience, really is required to set a standard and then be the steward of culture in a way. We're not the enforcers. Those are the folks on the ground who are actually doing the hard work. But I think helping to define that culture is really where service excellence comes into play and says, okay, wait, what is our culture? Who do we want to be every single day within every single interaction from no matter what role you are?
I think that's so important. And I think that, our patients should absolutely know that there's expectations.
Yes.
And they should have expectations.
They should 100%. Yes.
I guess when you need to do service recovery. So when things aren't as excellent, right, as we want them to be, how do you approach that? Or how do we? I hear that you don't enforce it, but I guess what's even just the approach?
When I say we don't enforce it, we aren't boots on the ground in every clinic, in every encounter, saying, "Oh, make sure you're looking at someone's eyes." But I think the setting the standard, setting the tone, and being sort of the stewards of culture is saying, hey, here's why it's really important to communicate, and here's what communication means for us at UCLA. So setting the tone. When that doesn't happen and something goes wrong, or there was friction, or there's upset from the patient or from the provider, that's where we come in and do some service recovery, and it looks different at every single time. It might be that a patient is really frustrated because something got canceled twice now. And now they're waiting, and they're in the hospital, and they're waiting for their next procedure, and they don't know when it's going to be. And the family was waiting, and they parked, and it's expensive, and all those things happen. We can come in, understand, hear where they're coming from. First of all, validate their experience. That's a horrible experience and frustrating.
Yeah, I want to cry at frustration hearing it.
Yeah.
Yes.
But validating and saying, I am so sorry that happened. Let us pay for your parking today. You guys came in the morning and you expected it to be in the morning. Here's some parking. Also go downstairs, get some food in the cafeteria. Here's some vouchers for the cafeteria.
Right.
That's sort of minor service recovery. That should be table stakes. And my hope is that every, at least leader on every floor or at every clinic is able to do that on their own. They have the autonomy, and they have the ability to go in and really kind of resolve those, maybe let's call them minor fires.
Sure.
There's service recovery where something really has gone wrong. Maybe we made a small clinical error, or just there's been mishap after mishap. And again, people lose trust quickly after mishaps. So how do we go in and resolve that? 9 times out of 10, again, it's about how do we communicate? How do we communicate our apology? How do we communicate why it maybe was a misstep and how we will resolve it in that moment?
Yeah.
And then let's hold the hand of that family and patient all the way through so that it actually gets resolved. I think that's a really big part of service recovery is not only, oh, here's a meal ticket, but I'm so sorry, acknowledging, really being a believer in what happened for them and in their experience, and then leading them through to the finish line of actually resolving it and following through.
And shepherding them through.
Shepherding through, yeah.
Do you find kind of advocacy then kind of like a cornerstone of what you do?
Yes. So critical. I think we are patient advocates to the nth degree, but we are also system advocates.
Yes.
And I think it's a duality because I think patients absolutely need advocates. This is a complex world. Healthcare is so complex and it's confusing and there's so many different facets. There's so much to navigate. But we are also going to be advocates for team members and make sure that there's appropriate behavior and a safe culture and ensuring that people feel safe to provide great care. And so I think that's, again, thinking back to, oh, you're just here to make the patient happy. We're not. We're here to make the system work and we're here to make sure that trust is built on both sides.
Yeah, on both sides. I mean, it just reminds me too. I mean, I think that, I have to tell you that every time I'm in one of our hospital elevators, I'm always like, oh my gosh, there's such a fine line between like today I might be rounding on a patient, but yesterday I was the daughter of, a parent dying and, 10 years ago I might have been, well, maybe a little bit longer, delivering a baby, you know what I mean? And just that there's this fuzziness and blurriness between our identities, but that the provider patient, while it's important to have, our boundaries depending on kind of our roles, we're all experiencing this together. And like you were saying, if something's not working, even just like a computer, that absolutely is going to inform the experience of who is providing care and who's receiving care. And it really does meet.
It does. Yeah, it meets right in the middle in a stressful way sometimes.
How do you advise, I think, a lot of clinicians and providers, we have a lot of areas where there's just like, it's busy, it's high stakes. So how do you kind of advise, our staff members, who might be feeling burned out by even just trying to, establish or restore trust in a really high stakes situation?
Yeah. I think this is one of the hardest things to navigate just in healthcare alone. I think there's so much burnout, rightfully so. Working in healthcare is hard. And when you're a clinician, it's 10 times harder. I mean, the expectations of the patients are high, as they should be, but they are high and the stakes are high. And again, nobody wants to be there. So you're there to support somebody that really doesn't want to be in front of you. And I think the thing to remember and navigate is a couple things. One, going back to the root of why did you choose to be in healthcare? Don't forget, we are here to be healers, especially providers and nurses and other clinical employees. All of you wonderful people have chosen this career to really heal people. And we can heal people sometimes by just holding someone's hand, by looking them in the eye, by giving them and providing them dignity and making them feel human, because humans enter healthcare. And so everyone who is here is a human. So I think remembering that. And then I think also working with the patient and being vocal and not just going in and assuming, okay, the patient understands and they know that I'm moving quickly, so I've just got to tell them and then I've got to go out. We have to narrate our care because narrating our care is safe care. And I think that's a really important thing to remember, that again, patients don't always understand. They are new to this. Sometimes it is novel for them. And so let's narrate what we're doing. Let's slow it down. Even if you have only 2 minutes, those 2 minutes can look very different, whether you're standing up, sitting down, looking someone in the eye, or typing on the computer, explaining in a rushed, very kind of convoluted, complicated way, or saying it in layman's terms so that anybody could understand. That 2 minutes is going to change the trust. And if we have trust, it's not a soft skill.
No,
like building trust, it's foundational. I mean, you will have patient adherence increase. You will have compliance increase. Errors get reduced.
Right.
And so all of that is really critical to remember.
Right. And just to sort of, be explicit about adherence and compliance, meaning that, for me in my primary care setting, right, if I can explain to somebody the why I want them to take this medication and what it does, they'll take it more than in case I just like throw it and yell medical, jargon at them. But, I will tell you, I mean, I love that we do have expectations, and we'll get into kind of our acronym, which encapsulates our culture at our particular health system. But I really do feel like patients, and so I am talking to our audience, you deserve to be have things explained to you, and very explicitly in a language that you understand. So, now even when I'm physically, I'm examining someone for their physical, I will say, even before, I'll say, is it okay if I, examine, the area above your collarbone? I'm looking at, feeling for any enlarged lymph nodes.
Right.
But I don't make an assumption that it's okay for me to even touch them anymore. Yes. And I will tell you that even when I was younger, again, I think there was this very paternalistic approach, and people were just like, you felt a little, I'm sorry to say, but kind of manhandled. And we do get complaints, I'm sure you too, where someone's like, someone put their, I was there because I was having an asthma attack, and someone, put their hand on my left breast. Yes. And so stepping back, I'm like, the stethoscope was probably placed, over the heart and then the lungs. But unless that was explained,
absolutely,
what you're doing, it just feels like someone put your hand on their breast.
Absolutely.
And so it's all just that explanation. And so that is our job. I don't want to ever make any patient feel like that's their job. But I definitely want to encourage and empower our patients to feel like they can ask questions and expect, explicit communication.
Absolutely. I mean, I think as a patient, you can even dictate, or at least not dictate, you can ask and say, I don't understand what you're sharing. Can you explain it differently? Can you sit down for a second? Right. I feel like you're rushed.
Right.
Is now not the right time. And even just those reminders hopefully will wake somebody up and say, shoot, I'm so sorry. Let me sit down.
I always appreciate those reminders. Listen, I'm in a clinic though, and so people feel usually a little better than they do in the hospital. And so I do want to acknowledge too, again, we don't want to put the burden on the patients always, right? Because even just scripting it for them is hard. What advice or, can you give to share with our families, what I mean, who might have a little bit more kind of, a little bit more of the composure to, I think, sort of,
Absolutely.
Advocate for their loved one.
I think families don't get included enough when we think about healthcare, especially in the hospital setting. Families are such a critical component and aspect because, to your point, so often, the patient isn't in full capacity. And so when we have family members there, it's so lucky, not just of course for the patient and, as a loved one, but it's so lucky for the system because then we can leverage information and we can meet the family needs where they are at and meet them where they're at in a way that works for them, because what works for them probably works for that patient.
Right.
And so I think including the family, understanding what their needs are, asking questions to them, learning some background, I think context is everything. Yeah. And healthcare is a contextual industry.
It is. And they can represent probably more of what their loved one.
Absolutely. And so really including them is also quite critical.
It's so helpful.
Yeah.
And I'd love to, I love that when you talk about service excellence, you mentioned culture, right?
Yes.
And sort of, that you're setting this standard. And again, at our particular health system, but I think a lot of health systems, we do have, standards and around culture. We have something called CI Care, which is an acronym standing for Connect, Introduce, Communicate, Ask, Respond, and Exit. So I know I said that quickly, but I'd love to know from your perspective as chief of the Office of Patient Experience. I always think you have actually the coolest office acronym, OPX. I want an X in mine.
Hey, thanks.
I don't, but tell me how that's operationalized across a health system, right? But again, kind of why it matters so much.
So CI Care was born at UCLA. It was born 20 years ago, actually, and it was trademarked at UCLA as this framework for how we interact with people. And to your point, it's what it stands for: connect, introduce, communicate, ask, respond, and exit. If you think about those words, it's really how do we interact as humans organically. It's a very organic thought process to thinking about. First you connect with somebody, and then of course hopefully you introduce yourself. You're going to communicate what your needs are, what you're doing. You're then going to ask if they have questions. You will respond to those questions, and then the ending should be with grace and courteously.
By the way, this should go for everyday life.
Everyday life. Right. I mean, when I talk about CI Care does not just belong in the hospital. CI Care is out in the world. I mean, I talk about Trader Joe's often. When you go to Trader Joe's, the person checking you out will somehow find a way to connect with you.
Somehow.
It's amazing.
Every time.
And they do it every time, and they do it flawlessly. And they might say, oh, you know, what kind of dog do you have? I see you're buying dog food. That is CI care.
Yes.
That is human connection. We want that. We crave that. We are humans. We need connection. So
I fall for it every time. I'm always like, do you really want to know what I'm doing this weekend?
100%. Same. I'm like, oh gosh, I love
No,
Trader
it's
Joe's.
authentic. And that's the
It is
part too.
authentic.
It's authentic.
Yes. And so I think when we can be our authentic selves
Yes.
and create this interaction that feels organic and unique to us, but still follow this interaction that ensures we are hitting those points, communicating, responding with empathy, leaving the room with empathy and courteously, that then all of a sudden the standard becomes our culture, and our culture becomes who we are and how we deliver care across the spectrum of care. And so CI care has evolved and grown across the system. It's grown across the country. People have definitely used CI care.
And we can evaluate too, you know, how we're doing on
exactly, it. Exactly. It's a measurable action that is really responding to how we want to be in front of our patients and also for each other. How do we interact with each other?
I mean, I love it too. I mean, I really actually love this framework. It actually started when I was a resident. Wait, did I just date myself? But I think to something you mentioned earlier, I mean, again, it's every individual interaction, but also kind of at a systems level. So something can be, it reminds me, right, that every individual makes up, right?
Totally.
You know, this culture and this aggregate of experience.
Yes, absolutely. I mean, when the way that I talk about CI care has evolved so much, but it's a verb, it's an adjective, it's a noun. I mean, it can be so much, but it really, I think, at the core of it is who UCLA is as a culture, because we really do care about connecting and communicating responsibly to patients and to each other.
Yeah, no, and that's why it's meaningful for our patients too. Okay, it's our asking for a friend section.
Okay.
If someone's being admitted to the hospital, and you touched on this as well, and I do want to actually reference an episode that we've already done with the chief medical officer of Ronald Reagan Hospital, one of our UCLA hospitals, about being a hospitalist. And so you guys have said very similar things. But what are 3 things that you'd encourage a patient or their family to do early on? Or it doesn't have to be 3, those, you know.
I think so. They're entering the hospital. What things would they do? I would say the first thing is understanding who their care team is.
Yes.
I think that there's an assumption. If you're going in for a heart attack, you maybe have an assumption, understandably, that you're going to meet with a cardiologist.
Right. A heart doctor.
A heart doctor. But you also might meet with a few other doctors, a few other consults that are related to your care, whether it's because you have complications or you have other things going on in your body. And I think really ensuring that you and your family have an understanding of who are these people? Who is my care team? Who should be coming to my room? And when they do come to my room, do I know who each person is? That's really critical.
Yeah, maybe writing it down too.
Writing it down.
I would never be able to keep track of everyone.
Of course, there's hundreds of people.
Right. It's like a whole cast.
Exactly. The next thing I would say is when you don't understand, ask questions. You are allowed to ask questions. We want you to ask questions. We don't assume that you know everything, but when we do, we're so sorry.
Yes.
And we want you to push us and prod and find out more information. If you feel confused about something, ask. The third thing I think is don't forget everyone does have the best interest in their heart. Like they have your best interest at heart, I should say. And I think that it gets confusing or it might feel conflicting when there's so much going on and your procedure has gotten moved or you don't know where your meal is or your provider hasn't come by your room
You're
yet.
Thinking about how expensive everything is. Yes.
The billing is complicated.
Yes.
I mean, it is complicated and it is stressful. And the system does really care. We want you to have great outcomes and we want you to have a good experience.
Julia, are you running around the hospital and clinics talking to everybody? I mean, I really do feel like, I mean, you could come up and explain anything to me. I mean, I'm really impressed by what you do and how you talk about it and obviously what you're leading. I am curious. I mean, so obviously you have your teams, right?
Yeah.
But are you also talking to patients a lot?
Yes, I am talking to patients. It is my favorite thing to do. I do it every single day. I think that if we are not talking to patients, then we're missing the mark, because patients, again, that's a signal. The conversation with patients is going to give us light on who we are, what we're doing, what's going well, what's not going well.
So you might actually go and meet with people even if they haven't, quote, raised an issue.
Oh, absolutely. I'll do both. So
Yes.
if someone has an issue and I get involved, I actually love having those conversations and figuring out what went wrong and understanding, doing some firefighting. The other great thing to do is just honestly wandering through the hospital, picking a unit and just walking into a room, knocking on a door courteously and communicating who I am and just saying, how is your care? How are we doing? What can we be doing differently? How are things going?
Yeah.
Are you getting everything you need? A lot of times they might say no, and they might share information where you can't actually just solve it immediately. But oftentimes they might share something that you can actually solve right then. And those are things that I think are so beautiful. And then for the things that we can't solve right then, I go back and frantically, send people emails and understand, what's going on. And it provides us at least a focus for what the next initiative even might be.
But it doesn't sound like you're afraid of hard conversations.
I love hard conversations.
That is not everyone.
I don't know where that came from, but I think that at the core of a hard conversation is honestly fear. And I think if we remember that, again, people are suffering. And so if we remember that people are suffering, people are afraid, yeah, they might be a little elevated. They might swear. They might not like me. They might say rude things. But at the end of the day, it's because they're afraid. They don't know what's going on. So to provide, I think, a level of calmness and clarity, everybody deserves that.
Yeah. But it's calmness and clarity for sure. But I also what's really emanating from you, though, is that you really want to make it better.
Yes. And yes, we really care.
Right. And that you really care. That's amazing. I think I trust you.
Great.
I'd always trust you.
I trust you. You can be my doctor.
I'm curious how things actually get, I guess, escalated or even just brought to your attention. So I understand you're kind of walking around and querying, but let's say someone is having an issue, how does it come to you? And I guess I'm asking this on behalf of a patient or family member. Let's say I am in a clinic, right? Or I came home from the clinic and I wasn't happy with an interaction, or I'm a patient or a family member is in a hospital bed and I'm having an issue. So who do I raise that concern to?
Great question. So we have a process for that, and it's reaching out to our patient experience office or our office of patient experience. And we have a group of amazing advocates that take care of the system. They oversee all complaints and grievances. So grievances are formal complaints that people will submit from whether they were patients in the clinic or patients in the hospital or family members. And then we review them and we respond to them either the same day or within 24 hours. And that is really critical and really important that we are responding and that we're at least investigating what happened. Now, it might be that somebody didn't, quote, like the doctor, and so they don't want to pay their bill.
Right.
Okay, well, that's good for us to know. We might mark that down and record that, and there's a process for that. Are we going to pay for your bill? Probably not. Care was probably rendered appropriately.
Right.
We'll explore if care was rendered
We'll have
appropriately.
that conversation for sure.
Absolutely. But other things that come up, they all bubble up through my department. When something gets even more elevated, it goes to our director of patient experience. He's also equally wonderful. He's overseeing this team of advocates that's really spending their entire day navigating complaints and grievances. And then from there, it'll go to me, and we'll work together to think about, okay, what happened? Who do we need to get involved? Where do we need to investigate, et cetera?
So, the office is, I know, is at least in the hospital that we both work at, is an actual, brick and mortar office. But if someone's in a hospital bed, do they pick up the phone? I know I'm getting very tactical. But it's great. Do you say to your nurse, I want to talk to the Office of Patient Experience, or can you go online?
Absolutely.
Okay.
It can be either. So the second you say, I'm frustrated.
Yes.
What I want to happen is I want that frustration to get to my office. It can get to my office through a phone. We have a phone line. It can get to the office through an email. You can walk into the office physically. Right. Or you can tell your nurse, and the nurse can tell their nurse leader, and that nurse leader can call me directly.
I see.
So there's so many modalities.
Okay, so there's lots of avenues.
Absolutely.
And are most health systems like ours in terms of having?
Exactly.
So most health systems have an OPS.
I don't know a health system that doesn't have an OPS.
Okay, good to know. Okay, no, but this is just great because just for people who are listening who aren't at UCLA Health, this is part of healthcare, is having this Office of Patient Experience.
Submit your complaint. We want to hear about it.
Okay.
Yeah.
Okay. Lastly. What are 3 things that you wish everyone understood about patient experience?
That we are on it's not a singular side that we're on. We are on the side of this system, which means patients and employees.
Yeah, that's great.
And I think that is really critical. We are here to advocate for the patient. We are here also, as we said earlier, to advocate for the provider and the nurse and every single person who works in the system.
Yeah, it's amazing.
And we really believe in safe care. And so that looks differently for everybody, but ensuring that it's safe for the patient and ensuring that it's safe for the team is the most critical thing.
Yeah, I love that. Just that it's just this very symbiotic relationship.
Absolutely, yeah.
For clinicians and staff, any advice for us?
We're with you.
Yes.
We're on your side.
It feels that way.
I think, it's really important for them to know we're here for them too. We are here to help set boundaries. Sometimes that needs to happen. Sometimes people are inappropriately behaving inappropriately. And we are here to help support those conversations. And I would say this, especially for physicians, because I know I get a lot of eye rolls sometimes when I talk about this. Kindness is not soft. Kindness is strategic. It will build trust with your patients. And figuring out what that looks like for you is going to set you apart, and I promise you, going to improve your own satisfaction as a clinician interacting with patients.
No, from your mouth to everyone's ears. I could not agree more. I was loving when I was reading, the description of your role, and it says you lead system-wide efforts to elevate the patient voice and strengthen a culture grounded in communication and kindness.
Yes.
And my goodness, that is. It's quite a job.
Thank you. It's an honor to have that job.
Honestly, I feel the same way. I mean, and I'm so grateful to work, alongside with you. And I'm so grateful for your time today
thank you for having
chatting
me.
with us. I mean, but I would be remiss if I didn't say, I really admire the work that you're doing. It is hard to sit with discomfort, and vulnerability and humanity, every single day. I'd love to echo what you said too. Just, all these small moments really matter.
Yeah.
But your leadership really, truly matters. And to our listeners, I just want to emphasize what Julia was saying, that if something doesn't feel right, if you're confused, uncomfortable, if you don't feel like you're being heard,
yes.
If you have the energy, speak up. If not, engage your family member,
yes.
Other members of your care team. But your experience matters, and your voice actually helps us make care better for everyone.
Absolutely, yes.
Links to evidence-based resources, show notes will be in our episode description. And until next time, stay curious and healthy. We'll see you next time on Medically Speaking. Thank you, Julia.
Thank you.